Hey guys, and welcome back to another video. So this video is a real-time nursing interview. I mean an actual nursing interview for a band 5 role in a nursing home. I've done this interview for a long time, and honestly on that day I wasn't planning to record, but I just thought I should just record myself just to assess myself, and it has been on my phone for so long, and I just thought maybe I should share it here and we just learn together. And I want you guys to please leave your comments, what your thoughts in the comment section, and just let me know how you feel about this video, where you feel that I could have improved or not.
It's time of the love.
Good morning.
Good morning.
I can't hear you. Is it me or is
Oh,
it you?
it was me. The mic was turned off.
Nope, still can't hear you.
Can you hear me now? Earpiece. Just a minute, let me get an earpiece. Earpiece. Wired. Wired earpiece.
Why don't you log off and try again? Or
Oh,
try the headphones, see if they work.
so the first issue here, and something that I would like you to please work on and try to avoid, is any technical issues, especially if you're having a remote interview. So make sure you have your wired earphones, or just make sure you have everything sorted out before the interview starts. Okay, let me log off first. Hello.
Hi, I can hear you now.
Oh, great. Morning.
How are you today?
I'm fine, thank you.
Great. So my name is Shil. I'm the clinical lead for the nursing home. So nice to meet you. Thank you for joining us today. Now, before I continue, are you happy for me to record this interview?
Yes.
Okay. So I will be making some notes as we go along, so you'll see me not looking at you. Okay. So thank you, Samuel, for joining us in this interview. Could you just, I'd just like to ask, where did you find out about this post, about this vacancy?
It was on Indeed.
On Indeed, okay. And have you had a chance to read up about the home? Do you know where we are, what we do?
Yes, I've read about the home. I know it's a nursing home, and uh, deliver dementia care, palliative care, complex dementia care as well. And it has a maximum capacity of individuals. It's located a little bit in the, I don't know how to, probably let me call it countryside in Milford.
Okay. Have you ever been in the area? No. Have you been to that side?
Well, I've been to a couple of times, but I'm not sure particular to that
Where
area.
exactly the home is? Okay. And where are you currently based?
I'm in.
Okay, so not too far, about 20 minutes away from us. Okay.
Not too far.
So I'll just give you a little bit information about the home itself. So we are, as you read, we a maximum capacity of 28 residents. We are dual registered, so residential as well as nursing, and currently we have both sorts of residents. Okay, so you can see from the first aspect of this interview that it was more of just getting to know each other and asking about my location. Now, you may think this is just a sort of means to make me just feel comfortable. Actually, it may be, but one actual other reason is that they are trying to see how proximal I am to this nursing home, like how close I am to that nursing home, because they wouldn't want to employ someone who is like very far, so they don't come late to work because of their location. So this is something to note when you are applying to jobs. You let them know that you are willing to relocate, just like I said, or that you probably drive, and how long it takes to get to your desired, like to that place that you're aspiring to start working. um Our current profile is predominantly dementia with significant behaviors, mostly because you can't put other sorts of residents when you have residents with dementia. So currently our profile is dementia residents. Um, we have one nurse that is on shift on the daytime, one nurse on the nighttime. During the day, depending on how many residents we can have 3 to 5 carers, and on night we will have 2 carers on. Um, During the weekdays, we have management, so there's a manager on site, we have an admin team, we have maintenance, and then there's the domestic, kitchen, laundry stuff. All those people are around during the daytime. On the night time, it is a skeleton staff of just a nurse and 2 carers. Okay. Um, we are based pretty much in the countryside, yes. We are quite a rural place. I if you're comparing to London and other places. It's also rural, but we are quite out in the countryside. We don't really have a bus service that comes to us and things like that. It can be a bit tricky. So, do you drive?
No, but if successful, I'm planning to like move closer to
Closer, okay,
the home.
to
Yeah.
the place. Okay, right. So that would help because public transport is a little bit difficult. So currently, what happens is that most of our staff reside in Mill itself, and whoever's on shift, they come in the same taxi together in the morning,
Oh.
and they go home in the evening to get together in the same taxi because most of them don't drive. So it just makes things a bit easier for them because they're closer and they can get a taxi in.
Yeah.
Okay. So what I'd like you to do now is just take me through your nursing experience and what's really motivated you to apply for this role.
Okay, so my name is Samuel and I am a nurse. So I have been in the adult and elderly care for about 2 years now, mostly for dementia care and some little bit of palliative care as well. One of the things that motivated me to apply for this role is the the ability to like care for the elderly, like a bit of a personal thing though, but I did not really grow up to meet much of my grandparents, so I feel very attached to them. And then I believe as a nurse, these people are in a vulnerable stage of their life, so it is my responsibility to show them compassion, care that they need and they deserve. So that's what has been motivating me, and that's what motivated me to apply for this job as well.
Okay. Right. So, tell me a little bit about your nursing background itself, not just in the UK. I know you studied in
Oh,
Nigeria. So,
yeah.
what sort of skills are you bringing to the table? What's your experience with, the nursing profession?
Okay, so I've had experience both in nursing home and hospitals, and some of the skills I possess, I have the ability to do wound dressing, administer medication of all different routes. Um, compassionate and empathic. Uh, I'm a great advocate for patients, and then I um, always try to undertake new trainings to sharpen my skills, such as manual handling, good documentation, um, catheterization, and yeah, what else am I missing? So,
No, 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 that's fine. Thank you very much. So, um, within the UK, you've only worked within the elderly care setting. Is that correct?
yes.
Okay. So, in your last few, I see you've had 2 years in a nursing home. Could you just run me through what sort of things you did there as in your capacity as a registered nurse?
Okay, so some of the things I did there, some of my responsibilities were overseeing of shift and uh, giving of medication to the residents, also monitoring them in order to detect early deterioration from their health or their usual pattern of life, and then risk assessments, care planning, if need be, admissions and discharge, although that's not like something that happens every day, and emergency response, because we could have people who could fall, risk of falls, or just some other things that may happen within the home that would need an emergency response.
Thank you for that. Um, so, explain to me, can you describe a stressful experience you've had and how you coped with it?
Okay, I would I would probably describe a previous incident, an incident in one of my previous roles. So it was a bit of it's a bit stressful because there was a bit of miscommunication, and when there is miscommunication, a nurse's job cannot be done effectively. So one of the things that happened was there had been a medication time change, but it was supposed to be given. I mean, it was usually given at night time, but it had been changed to evening time. So I thankfully noticed that it was given earlier in the evening. If not, I would have given an overdose. So I had to be sure that the medication was actually given. I counted the dosage in and tally it with what has been signed. I tried to contact the previous nurse to confirm, the nurse who worked the day shift, to confirm if it had been given. And after everything, I also spoke with the line manager, um, and just to clarify. And after everything, I documented the finding and adjusted the mar chart so that subsequent people would not make any mistake.
Okay. So, when you are providing personal care to a resident, how would you protect their dignity, privacy, and how would you expect all your other colleagues to do the same?
Okay, so when providing personal care, um, first thing that is most important is consent. Although some of them, due to probably advancement of dementia, can always refuse and all, but we as carers, or I as a nurse, should be able to understand my patient or my resident at that point in time, and I would have definitely find a way to be able to convince her on why she needed that personal care. And then the second thing that is important is privacy. You can't be providing personal care in like a communal lounge. And another thing to add, depending on the resident, they could have wishes. Some could prefer, oh, just females to do her personal care, or the other way around. So it is also important that their wish are respected, and then to handle them with respect. Do not just turn them around. I would not just turn them around. I would ask for them to, if they could move, or gently change their position. And if they require assistance, like if it's a person that needs two people for personal care, I would not just go ahead to do it by myself just to save time, or just to get my work done quickly. So I would do it in a safe and professional manner. I think one mistake I did was that I was not looking into my computer. I was sort of staring up, and it's just because I was a little bit nervous. I had done some couple of interviews before that day, and I don't know, I was just so scared. Just for no reason, I was so scared. Or not scared, nervous. I was just so nervous. So I think that is why I look, did not look a bit too much comfortable on camera. And yeah, that's just it, really.
Well, I mean, it is important. We find that a lot of the carers, just to get their work done, will do everything for the residents instead of letting them do what they can. And in that process, we diminish their
Oh,
ability, the
yes.
cognitive everything declines much faster because we're just doing everything for them. So I think that's quite important, is that you let them do as much as they
as
can and
they
assist
can.
where is necessary. Yeah. I
Yes.
mean, you already did speak a little bit about, taking part in like trainings, like manual handling and things like that. But what do you do that's outside of the mandatory training to keep yourself up to date with, best practices or things like that?
Well, so one thing I do is I usually go on like YouTube sometimes, and I just watch like videos on latest practices and all, and signed up with some newsletters as well, such as like RCN, Unison, all those NMC as well, just to get journals or like magazines that has to do with any latest advancements in health practices.
Okay. So you haven't had to revalidate as yet, have you?
No,
Not yet. Next year?
next year, December.
Next year. Okay. So the role you've applied for, you would need to combine a hands-on approach, your technical skills, along with a leadership role, as well as lots of admin. So how do you see yourself combining these three different aspects?
Um, I think I would do a great job because it everything has to do with planning. I have to like once I start and I get to know my responsibilities and what is expected of me, I would plan my day. I would like of course making sure I do not like neglect residents because I want to do something else. So it has to do with planning, patient safety first, and then those with low risk and other things could be done. And if needed, delegation could also be put in place and adequately following it up.
So with delegation, how would you um, handle delegation? How would you handle the follow-up that's required for delegation? With
Okay, so
delegation.
before I delegate, I have to make sure, or I would be sure that that person is competent to do what I am asking of him or her, and after a specific time that I think they should have completed that task, I would go and check if they have completed it and just to confirm that everything was done rightly, how it should be done, and rightly documented as well. Because if it's not documented, it's not done.
So just a follow on that with that respect is, I mean, you've worked in care homes before and you know that care staff don't always do what you ask them to do. So in that respect, if you have conflict with someone you're asking to do something, or you've delegated something and they've refused to do it, how would you handle that situation?
Okay, such situations happen, but one thing I would do is to have a non-confrontational conversation with that person and make them realize that it's not that I'm being bossy or something, that it's just my responsibility and I'm just trying to make us work together as a team. And I'll try to reason with them. But if that does not work out, then I would have to speak with either the clinical lead or manager and let them know what is happening and why this person is probably being so difficult to work with.
Have you ever been in a situation like that?
Just once, the person felt I was too young because it's an elderly person to tell them what to do. So I just had to like tell them that we're just doing our job. Like outside of the job, I can't tell you what to do.
Okay, so um, what sort of issues would you expect to escalate to your manager or somebody more senior?
um, if there is like conflicts that could not be resolved,
Mm-hmm.
um, emergency situations the manager should know, even if I have handled it to some extent. Then situations such as medication error or I'm not sure if I mentioned it earlier, accidents, um, probably a patient's relative called to complain that their ward is probably being neglected or something. I would of course let them know. And also if they compliment, they also have to know. Yeah,
Yeah,
they
of
also have
course.
to know that.
Yeah. Oh no, thank you for that. And have you ever had to refer any of these things in your experience?
Um, well, I've had to let the manager know a few accidents that probably happened. Probably someone um, was found on the floor, things like that, and also a few complaints as well, because there would always be some little
I
bits
mean,
of
that's the
complaints.
nature of our work. It's we deal with people. Sometimes people have some expectations that we're not able to meet, and they're not
Yeah,
happy about that. So,
yeah.
yeah. Okay. So, in this particular role, there will be times where you are essentially the boss, yeah, because you will be the senior most person available to, answer the questions of the staff or to handle whatever comes. So, how do you see yourself, solving things when the manager's not around or there's no senior person around?
Okay. So I do have leadership skills, and I've worked in care home before, so it's not something that I would say is very new to me. The first thing I have to do is to get familiarized with the policy of the home, how things should be done, and if it's about like patients or residents, like they're asking questions like, oh, what do you think we should do about this? As my knowledge as a nurse would be able to guide the response that I would give to them. And also in situations maybe there is conflict probably between each other's staff, I should be able to resolve it.
Think, I mean, you'll always have someone you can call if you ever need to, but sometimes you need to be able to do these things before you escalate it
Yeah,
to somebody else.
yeah.
Okay. So, um, how do you feel you'll cope with the demands? I mean, you'll cope. Yes, we all cope, but we eventually get there. But what sort of challenges are you expecting in this role?
Challenges. Well, it's a healthcare setting, so I'm sure there could be. I do not expect my day to always have like a specific way it would go. I know like I can plan how my day wants. Probably okay, I want to start medication this time, but there could be
Not
something
always go as
else.
planned.
Yeah,
Yeah.
so I have to be flexible, and I have to be able to quickly adjust to whatever needs that would arise.
So that's one of the challenge you're anticipating. Is there anything else you think you might, struggle with initially until you get, you know, your head around things?
Mm, I think something else which is very common with nursing homes is like getting to know like each resident on a bit of a personal level, like getting to know them very well, so I can be able to like render personal care, no, um, not personal care, person-centered care.
Individualized care. Yes, no, I
So
understood that. Yeah.
uh, yeah, so I think that could be, but it's not like I don't think it would be something big of a challenge. Just within some weeks, I should come around.
as the nurse, would you achieve well-being for your resident, well-being outcomes?
Well-being.
Mhm.
So beyond just giving medications, I have to monitor their intake and output, making sure they are eating well, because whatever goes inside determines how their health is. Making sure probably those who are like prescribed a particular kind of meal are getting it. Um, of course, also ensuring the staff does the personal hygiene that they need, making sure they are clean, their clothes are changed, people who need their nails cut or hair done, just ensuring all that is being done for the residents.
Thank you for that. Um, what is your understanding of person-centered care?
Okay, so I believe person-centered care is when is a kind of care that has to do with individualistic. Um, so people are different in different ways, and a nurse should have the ability to give a care to somebody based on how they want it. Like somebody could like to take their medication with water, while someone else would like to take with squash, and I would not just assume that, oh, this person took my medication with squash. Everyone would want it with squash. No, some people would prefer water. And for example, as well, given personal care, some people could have gender preferences. So that is what all those little differences, their daily habits, their preferences, their choices, are what constitutes person-centered care.
So that those are really good examples.
Thank you.
So could you go over the purpose of care planning and risk assessing and how often you would do this?
Okay, so risk assessing and care planning is in to help staff and nurses, all people in general caring for a particular resident, to know the patient very well, to know where they may be vulnerable, and where they may need help. Just generally to understand a resident on a personal level, and to be able to know what level of care they need, because y- uh, we mentioned earlier that some people just want to do everything for the resident, not allowing them to do certain things that they can do by themselves. So someone who is familiar with their care plan would know that, oh, Mr. B is able to wear his clothes by himself, just prompt him to do that. And how often should it be done? Care planning and risk assessments should be done every month or when required. When required in instances like maybe there was an accident, probably somebody fell or something, I would need to like review their full care plan and see if anything needs changing.
Thank you for that. So when you're reviewing the care plans, how would you ensure that they're done in an effective and person-centered way?
So, um, I would involve because some people have like a, how do they call it, like a carer who is like particular to that person, not really like they just care for that person. So one thing I would do is
A key
to
worker, sort of.
yes, a key worker, that's the
Right.
term. I would speak with a key worker. I would also speak with a resident, and I would also speak with the family, just all those people uh, that make up the person that resident relates with, and those that care for them. So I would speak with all of them to see what needs to be changed or what I need to involve in that care plan.
Thank you for that. Now, obviously, we're dealing with residents with dementia.
Yeah.
So, just go over what you understand about the Mental Capacity Act, dolls, and best interests.
Okay, so mental capacity act is it has to do with um, like how patients or how residents are able to make their decisions. So residents are being reviewed to by probably the mental health team mostly in order to know what their mental capacity is like, and then that would um, guide us, the nurses or the carers, on how to make probably decisions for them or that which they are allowed to do for themselves. And then you mentioned dose. So dose is like deprivation of liberty. So there are certain people that would need doors in place for us to probably care for them, like putting people in a care home, locking the door for their safety. So they personally they may want like to go out, but because we know that it's not safe for them, they could probably walk into the road. So we need like to put doors in place.
What about best interests?
Oh yes, best interest. So best interest is when we as carers or nurses have to make decisions on behalf of residents or our patients because it is what is best for them at that time, and then it depends on their mental capacity before would have to like make decisions for best interest. For example, probably somebody with an infection is prescribed antibiotics, but they keep refusing. uh, We could have to like probably do a covered medication, speak with the GP to get a covered medication. So they are having that medication in their best interest, even though they don't want it. So it's basically when we do something for the interest of the residents at heart.
Now, staff would obviously expect you to provide answers to them for their various questions and make decisions. How would you deal with that?
So I would well, first thing I would do is the thing I always do is to make sure I'm always up and up with my knowledge, always reading, getting to know residents, getting to know my patients or company policies, how things should be done, and peradventure I am unable to answer a question, and if it's not like something that is like probably very important, like an urgent thing, I'll just tell them to give me some time because I'm not too sure about this to clarify with someone else because I could like probably the person on call just to be sure to speak with them and I will get back to them.
How would you deal with complaints?
Um, complaints from I'm guessing residents' family maybe.
Anyone, yeah, anything. It could be staff, it could be a family, but the thing is essentially your philosophy on complaints. How would you
Oh,
handle a complaint? Yeah.
all right. So first thing is to listen. So I would listen to them, hear what they have to say, and if it's something that I am like I have a bit of knowledge about, it's probably a complaint maybe about probably food or maybe time they had their medication. I would try not to justify like what they are complaining about, but I would try to like um let them know like this is probably why it happened, but then also apologize and tell them that would like would work towards making changes. And if it's probably staff maybe, I'm the best thing I can do is to listen, and if it's in my capacity to make any change, any favorable change, then I would do that as well.
So, how important do you feel it is to involve the family or your residents' representatives in planning their care?
Oh, it is very important. Residents' family are they are like part of what.
Don't worry about that.
Oh, okay. Residents' family, they are part of what makes a resident, their daily habits, their behavior, and generally what makes them who they are. So, in order to make a person-centered care plan, I have to involve them, get to know what the residents' hobbies are, what their routines are, what they prefer, but their preferences.
Mhm. Yeah, no, of course. I mean, if you don't know, they probably are the next best people to know.
Yeah.
Okay, it's just a few more questions to go, and then you'll have a chance to ask me anything if you have some questions. Um, can you tell me the 5 rights of medication management?
5 rights, okay. Right medication, right route, right time, right
Mhm.
dosage, right patient, and I think there's. Oh, okay, that's 5 already.
No, that's 4. You missed
Oh,
one.
okay. Right patient, right time, right route, right dosage, and right to refuse.
Right medication. So you got the
Oh, right
5.
to educate.
Then there's 2 more extra ones.
Oh,
So one of
okay.
them is right to refuse, and the other one?
Um, oh, can't remember. Right.
Right documentation.
Yeah, right documentation. Yes.
So could you walk me through the process of administering a controlled drug?
Okay. A controlled drug has to be done by 2 nurses. Usually 2 nurses. Some company may differ, but it's usually 2 nurses. So the first thing is to go with the person, um, have open in with the other person witnessing, open the cupboard, check like who's to have their medication, check the name and the dosage, make sure everything is accurate, then document um, what I am taking out and count the stock to make sure what I'm meeting is what was last documented. So after taking out what I'm going to give the resident, then I sign and my witness also signs it as well, and I put it back in the cupboard and lock it. And then of course I give the patient their medication and document.
If you made a medication error, what process would you follow?
Um, so that is um that is called I
Just
think
any regular, a regular
oh,
medication
irregular
error.
medication. Okay. Nurses have responsibility to be honest, duty of candor. So, uh, if it were to happen, the first thing I would do is to assess the patient for any probably side effects, and then let the GP know that this is what has happened, and follow the advices that has been given. And I would let the patient know, excuse me, even though in care home centers sometimes due to their dementia they may not understand, but I'll just let them know, like, okay, if you're feeling anyway, just let me know, or just to tell my staff around, like if they notice she's doing like she's behaving out of her usual, they should let me know as well. Then the next thing is to inform the line manager and the patient's relatives. Then after all that is done, incident report should be done, documenting the medication that was given and that which was meant to be given. As you must have noticed, there were some times that the interviewer kept quiet. Well, this is basically she just, writing down points based on everything that I've said. And I guess that is what will be the basis of how I'm scored for the interview. So, like, so if you are in an actual interview, this is a period for you to actually like just reflect on the answers that you've given and mentally prepare yourself for the next question.
So we know, as a nurse, documentation is very important. Okay, and we will be documenting whether you like it or not. But the challenge we face is that sometimes the documentation is not effective. So, how would you maintain the standard and quality of your documentation?
Okay, so maintaining the standard of documentation, first thing is to ensure that it is legible, and I use appropriate words to to describe the situation, and not try to like shorten it in a way, make it easy to understand for someone such as I mean, so that even someone who was not there, if they read that
No.
documentation, they would be able to like understand very well, like, oh, this is what happened, and then avoid shorten words, and then proper dating and timing after everything, and also I put my signature. Then something that I think some people miss is space, a little bit of spacing. I know we don't have to put too much spaces in the documentation, but some people like they just write it together with previous people's documentation that sometimes it could be a bit difficult to know which is which.
So this is all with respect to written documentation. In your last workplaces, was it paper-based or did you have a digital software?
It was a mixture of both.
Okay. So in our setting, most of it is digital.
Okay.
We have very little paper-based
Okay.
documentation that needs to be done, but most of it is digital. So it already records your date and time and signature
Oh,
as you do recording. Yeah,
okay.
so that gets cut out. But just you have to, like you said, correct language, concise, that you're putting all the information that's required in. So no, that's good. Um, what understanding do you have of the current legislation and how it impacts your work?
Current legislation?
Like, are you familiar with the legislation that governs you as a nurse, that would govern you if you're working in a care home? Do you know anything? Like, do something like health and safety at work?
Oh, okay. Um,
Mm.
so, uh, health and safety at work. Like I have to make sure that my patients are put at safety when giving care, and then also have to make sure that I am not like putting myself in danger as well. Um, Proper manual handling practice. Uh, Having consent before giving care, adequate documentation, promotion of health and safety. Um, yeah.
No, no, that's enough. At least
Okay.
you have an idea. Yeah.
Okay.
Okay.
Thank you.
So the last question really is safeguarding. What is your understanding of safeguarding policies, and how do you do it in your role as a nurse?
Okay, so safeguarding has to do with like when somebody is probably at risk of something, then you have to make sure that they are like put we have to make sure that they are safe from such risks. Probably it could be abuse, maybe from a certain patient. I mean, yeah, patient family. So now my own in my previous roles, all the safeguarding processes was usually done by probably the manager. But what I have had to do was, if I am to notice probably any sort of mishandling of manhandling of residents or any sort of abuse, I would have to raise it, and in situations where necessary, do a body mapping. Maybe there's finger marks, do a body mapping, and everything should be concisely documented and reported to the manager. Then, if maybe the safeguarding has been raised and all, and probably such a person is restricted from visiting that residence, some of them could still come around, but as a nurse and I know about it, I would not allow that person into the home, making them aware that, okay, there's a safeguarding against you towards this person, so you cannot see them, I'm afraid.
Okay. So in our setting, yes, the manager does do safeguarding, but because you are usually the first point of contact, we also expect the nurses to be familiar with filling out the forms and raising the safeguarding, or calling the safeguarding team to, get advice or whatever is necessary. But if you are successful in the role, we will give you the necessary training and, show you how to fill in the necessary forms.
Okay.
So my last question, well, not really last question, but just for the official interview part, is have you got any restrictions on your NMC PIN?
No.
Do you have any disciplinaries or grievances that are currently ongoing against you?
Good. No, no.
Any offences or things that you've been convicted of that we may need to risk assess?
Like criminal offenses right now.
Yeah. Okay, no.
Now, of course, you will also be given opportunities to ask for questions. This isn't just, for you to talk about money really. This is a avenue for the employer to see how interested you are about career opportunities, about growth, and it's not really more about like money. This is a hit and miss really, and sometimes it depends on what the employer is particularly looking for. And even if you do well in everything, I think this question is so important that if you do not answer it right, it might make you get an unfortunately. Okay, so I think that is all I have to say. And what are your thoughts regarding this interview? Do you think I got the job? Let me know in the comment section. So make sure to like this video, comment, share, and subscribe. And I hope to see you in the next one. Until then, bye.
Let the beat whistle, just try to blend into the tone. Don't let the beat whistle, just let your praise flow.